In the previous segment, we discussed risk aversion. Aversion to risk is what makes people demand health insurance. We also discussed how the premium is derived. It reflects payment in return for lessening or eliminating financial risk. But this all assumes that risk is fixed and known to both the insurer and the individual seeking insurance. If risk is fixed and known, we can find a premium that would make the insurer and the individual better off. But what if risk is known to individuals but not to insurers? We call this situation asymmetric information. Individuals know more about their health issues, family history, and lifestyle choices than their insurer. In this segment, we will discuss how asymmetric information can lead to a problem of moral hazard and why the solution to this problem requires cost-sharing arrangements like deductibles, co-payments, or co-insurance. Moral hazard reflects the notion that under certain circumstances, individuals will alter their behavior and take more risk. The specific circumstances we will discuss in this segment is the presence of insurance. Moral hazard occurs when individuals have the opportunity to assume additional risks that negatively affects the insurer. The decision is based not on what is considered right, but on what provides the highest level of benefit, hence the reference to morality. So what is the solution to the moral hazard problem? To answer this question, let's look at a simple example of property insurance. When a property owner obtains insurance on a property, you might think that the contract is based on the idea that the owner will avoid situations that may damage the property. Moral hazard exists when the property owner, because of the availability of insurance, is less inclined to protect the property, since the guaranteed payment from the insurer lessens the burden on the owner in case of a disaster. Let's consider the risk-averse owner of a warehouse that is valued at $100,000. The warehouse contains hazardous materials that can be very flammable, and the annual likelihood of a fire is assessed at 1%. It turns out that the owner can reduce the risk of fire by providing fire extinguisher training to all warehouse employees. The training is subsidized by the local fire department and only costs $50. This training was shown to be effective in reducing the number of fires by half. That is, if the owner provides the program, the probability of fire will be reduced from 1% to 0.5%. The question is, should the warehouse owner provide this training? You might want to pause the video and answer this question yourself. The answer is yes. The warehouse owner should provide this training to his employees. If he doesn't, he faces an expected loss of $1,000. That is the value of the warehouse, 100,000, times the probability of a loss, 1%. On the other hand, the expected loss falls to $500 when providing the training, plus the $50 training cost. So together, the expected loss is $550. Providing training lowers the expected loss from $1,000 to $550. So exposure to risk leads the owner to be proactive about mitigating it. Now assume that the owner can buy property insurance and that the insurance company cannot observe, verify, or force the owner to provide fire prevention training. Since the expected loss is $1,000, the insurer would charge the owner a premium of no less than $1,000. Our risk-averse owner is thrilled, as he is no longer exposed to risk. Even in a case of a fire, the insurer will pay the owner $100,000, the original value of the warehouse. But notice that with no risk, there is no incentive to provide fire prevention training. This is the essence of moral hazard. The owner behaves differently with and without insurance. Without insurance, the owner would find it advantageous to provide training, and when insured, training is just a waste of $50. So how do we fix this moral hazard problem? The only way to do this is by not fully insuring the owner and expose him to sufficient level of risk that would make him take proper action. For example, the insurance company could choose a co-insurance rate C, which means cover only 1 minus C times the value of the warehouse. That is, if the co-insurance rate is 20%, the insurance company would only pay 80% in a case of a loss. In our example, the owner would be covered for $80,000, and in a case of a fire, will still stand to lose $20,000. The question is, what is the minimum level of cost sharing that would eliminate moral hazards? Let's assume that we found the co-insurance rate that would make the owner provide training. If that is the case, then the expected loss would be $500, and the expected payment from the insurer would be 1 minus C times $500. Since this is the expected payment, this would be the lowest premium that the insurer will charge the owner. So let's assume the owner buys this insurance and pays a premium of 1 minus C times $500. But the insurer cannot observe if the owner provided training or didn't. So the owner may decide to provide training or may decide not to provide training. Let's compare the two scenarios. In both cases, the premium would be identical, 1 minus C times $500. But if the owner chooses to train his employees, he will pay $50 for training. And if he decides to forego training, he pays nothing. But that comes at a cost, because the owner is now exposed to risk on his co-insurance rate. So if he trains his employees, his expected loss or risk exposure would be C times $500. But if he does not train his employees, his expected loss would be C times $1,000. So what level of co-insurance rate makes the owner's expected loss with training lower than the expected loss without training? Let's see. The premiums are the same, so we can ignore them. This leaves us with this expression, where we can subtract C times $500 from both sides. And now, divide both sides by C times $500. Here's our solution. The minimum level of cost sharing that would make the owner take action requires C to be greater than 0.1. So any co-insurance rate above 10% in this example will eliminate the moral hazard problem. So we eliminated the moral hazard problem. Yay! But unfortunately, the only reason we did was because this example is very simplistic. In reality, there are many types of actions that the owner can take to reduce the likelihood of fire. The owner can invest in adequate fire evacuation plans, waste and trash management, no smoking signs, automatic sprinkler system, and much more. So there is really a continuum of action that the owner can take. More actions means lower probability of fire, but it also means more investment in fire prevention. The more exposed the owner is to risk, the more actions would be taken. But moral hazard would be eliminated only if the owner bears all the risk. That is, if the owner has no insurance. So insurance will always create moral hazard, and coinsurance will mitigate it. In the next segment, we will discuss how deductibles and coinsurance rates relate to medical care consumption.